Hi, I'm Rivka Abrams and I am the Counselling Coordinator for our Athlone office. It is absolutely normal and natural for our survivors of rape or sexual violence to feel nervous, to feel like confused or in any other mental state. And because they're coming to an experience that they've never had before, really what is important for us to know is that it's just a conversation. It's someone there holding a safe space for you, holding a space that you feel listened to, understood, and supported. And I think that is what's important for our community and for our survivors to know, is that a first session or many other sessions after that is just about taking it according to your pace, taking it according to what is comfortable and safe for you as a survivor. And yes, I think it's also important to note that there is a couple of forms, and it's basically just about collecting your personal information, collecting the information about the presenting problem, as well as what other services you've been receiving before you actually came to us for counseling. And so that we have a record of where you are at, where or how far rather you are in experiencing rape trauma syndrome. That is very, very similar to post-traumatic stress disorder, and that's really just a group of symptoms like crying, behavioral changes, those kinds of things, kind of measuring where you are at and where you and your counselor's journey would lead to on your road to recovery. So yeah, it's really just a space that you are held and felt safe and listened to, understood, and that is the most important thing for us. So when we look at the approach with our survivors, it is very important for us as counselors to note that the principles of empowerment is very important. So when we look at the principles of empowerment, there are 4 principles, and that is looking at the safety, the physical safety of the survivor as well as the psychological safety. So the physical safety is that person in a physically safe space with us, yes. And do we provide psychological safety? Is this person feeling heard, understood, and being reassured that, we believe you? Because that really, really does a lot for a person. As well as what creates psychological safety is just being listened to and holding, that space and sitting with another person. So that is around safety. And when we look at the second principle, which is ongoing support, which we provide starting here the journey at rape crisis, but what we also believe around ongoing support is to empower, support, and educate family members and friends of the survivor, because at the end of the day, this is a safe space. We do provide support, but the home environment, the living situation needs to also be safe, and the survivor needs to feel supported and understood in that home space, which when we look at survivors, their behavioral changes might be different. Their attitudes, their day-to-day might be different than normal, than before the trauma that they've experienced. So we need to normalize that and make the family and friends or guardians understand that that is part of the trauma recovery process, the post-traumatic growth that needs to take place, understanding that and supporting the friends and families in that. So ongoing support is also very important in terms of if we discover that the survivor probably has a need to be referred to perhaps another substance abuse facility, for example, or perhaps having a safe shelter or safe space to stay for the time being. And a lot of the times that is because of intimate partner violence, or domestic violence along with sexual violence. Then we would try and look for a safe space for the survivor in that case. when we move on to the third principle of empowerment, and that is restoring control. So when we look at restoring control, we need to understand that when someone has experienced a rape or sexual violence in any way, shape, or form, there was no consent. Something was done to that person without that person's consent. Something was taken from that person without that person's consent. And through the road to recovery, through the journey with the survivor, we know and we understand as a rape crisis. And it's been proven that survivors need to make their own decisions. They need to be allowed to say, I'm ready to come for counseling now. No one can force you to come for counseling, because if you're not ready, the therapeutic process will not be not conducive, but it wouldn't really be as effective as it needs to be. It's always with a trauma or with counseling, the person needs to be okay and ready. The person needs to give permission that I am ready to take these steps. I am ready to go and report this crime. And that specifically, just to mention, is in the terms of if it's an adult, anyone 18 years and older, but just also to remember that if it's a minor, if it's a child, we have to and we are responsible to report the rape or the sexual violence. And restoring control basically is about you making your own choices. The counselor in the counseling setting would never tell you what to do. And we don't also give advice. We give you guidance. We give you options. And a lot of the time, some of our clients come where they fell pregnant because of the rape. And some survivors then want a TOP, which is a termination of pregnancy. It is not up to us to say yes or no. For example, we would then sit with that client and give that client options around, okay, so these are the places, these are your options, you choose, because you are now saying this is your decision. You are now saying you are ready, and we will support you with whatever decision you need to make for yourself. And then lastly, the fourth and probably one of the most important factors is that we need to respect. Respect is very important. We need to respect the survivor's decisions. The survivor needs to feel respected as well. And this is basically, as human beings, we have our dignity. So we're wanting to restore that dignity. We're wanting to restore that humanness, because a lot of the times our survivors walk out and survive the traumas and they don't feel like themselves. They don't feel human again. And we try and restore that by treating them with the utmost respect and believing them when they say whatever they need to say. Whether it is telling their story, whether it's telling how they were treated or not treated at other different services, for example. And with that is also understanding that boundaries are important for survivors, So as a counselor, we do understand that our boundaries are important, and there is a certain limit as to if and how and when we can assist the person, and we also need to respect the survivor's boundaries. And if the survivor says, I'm not ready to go there, we would absolutely say, that's fine. We will, try whenever you're ready. So that is the principles of empowerment, which is the main reason and way in which we work with survivors. What is important to create a safe space and a non-judgmental space is that we as counselors, we listen without judgment. We welcome you without judgment here into our physical space, whether it be in the office, at the waiting room, or whether it's in the counseling room. What is important also is that we assure our clients that we do believe them. We do believe our survivors. Everything that our survivors tell us we are the ones that would make you feel understood. And a lot of the times there aren't these safe spaces where people even want to listen to you with compassion. A lot of the times people just want to listen because they want to know the story. But we listen because we understand how important it is for you to feel genuinely safe and understood, so that we can move forward with your road to recovery, with your healing journey. And then ensuring that confidentiality is very, very important to us at a rape crisis, and respecting that and making it clear to our survivors that all of our information, everything that is said here, would stay here. All of your information, whether it is written or said verbally, our written folders are always locked away, and ensuring and informing our survivors that that is really how ethically, we work at rape crisis. And then really what is important is to create a calm and supportive environment. A lot of our survivors come from very unstable or violent spaces and homes, and a lot of the times their own homes aren't really safe. So even if we can provide that 1 hour away from all the drama, from all the chaos, from just having any safe space, a calmness, and a lot of the times our clients appreciate that space. A lot of the times our clients even just come into the counseling room, they sit because they need some comfort, some quiet, and they need a confidential space, even just to cry. Even if you need that space and that hour to sit and pour out your emotions, because the reality is, and we've learned this through rape crisis, and we've understood this, we do understand it, is that when your client needs that space to allow herself to feel her emotions, and that is what the session is about, that is okay, because that is healing. That is probably one of the most important parts of the healing journey, of the healing process, for you to allow yourself to feel what you need to feel. And if that is crying for half an hour, that counselor, will hold that space for you. Because we see the growth after that. We see the relief after the crying, after the tears. We see the space of growth that the client is creating in her body, in her mind, as she releases the tears, as she releases her emotions. And I think that is what is so rewarding for us as counselors, when we see that growth, because this job is really, really rewarding. And yes, we allow the story to be told, but we do also focus on the healing, and that is what makes this work so great as well, that we can hold that space. So survivors can access our services through many different ways. You can contact our helplines. We are on our helplines 24/7 during office hours, basically from 9 until 4:30, and then our line gets diverted. The numbers would show on the screen, as well as we have a WhatsApp line for appointments and referrals. But this WhatsApp line, the numbers on the screen as well, is only available during office hours, so Monday to Friday, from 9 until 4:30 and until 3:30 on a Friday. You are able to either call or message. Our counselors will be on the line to make the appointment for you according to which time you are ready. And also I want to reiterate that it is free. Our counseling is free of charge for all survivors, for all family members and friends, or any supporters of survivors. Our counseling is free and confidential as well. And then I think it's also important to note that we are able to provide 12 sessions per client, depending on the need. And a lot of the clients, they feel they only need a few sessions. That's entirely up to you, according to your need. But we are able to provide you with free counseling up to 12 sessions. Perhaps maybe if need be a little bit more, or we can see what your journey would look like. And just to reiterate that we do know and understand that the road to recovery, our post-traumatic growth looks different for everyone, because we understand at a rape crisis that each person is different. Each person experiences their trauma in a different way. And that also shows and has been proven that each person heals at their own time, they heal at their own pace, and they heal in different ways. And so I think it's also important to understand that counseling is perhaps not the only way. It can support you in any other way in which you also, need to heal.